Hola amigos, feliz viernes. Hoy es viernes, yo soy Rory y estoy contento de estar aquí contigo. Hoy nuestro tema es cómo evaluar la depresión en español. Y hoy vamos a usar como dos herramientas para guiar la lección. Primero el SIGECAPS y también PHQ9, so the PHQ9. La salud mental es un problema grande, ¿verdad? En nuestros tiempos actuales y depresión por lo menos está off the charts. Entonces, es un tema importante y estoy contento que estés aquí conmigo para aprender un poquito. Empezamos con vocabulario. Vocabulario sobre emoción y estado. So, una pregunta útil puede ser, ¿cómo se siente? How do you feel? ¿Cómo se siente? Aburrido, bored, agitado, agitated, agotado, like totally worn out and used up, agotado, ansioso, anxious, bien, well, cansado, tired, confundido, confused, contento, happy, deprimido, depressed. Of course, I'm saying deprimido. It could be deprimida, cansada, confundida, contenta, depending on gender, right? Despierto, awake. Dormido, asleep. Enfermo, sick. Enojado, angry. Feliz, happy. Frustrado, frustrated. Igual, the same. Inquieto, like restless or unsettled. Mal, not well. Más o menos, so-so. Mejor, better. Muy bien, very well. Muy mal, very bad. Nervioso, nervous. Peor, worse. Preocupado, worried. Regular, okay. Tranquilo, chill, cool, tranquil. Triste, sad, okay. Estas son muchas palabras, vocabularios para describir emociones o estados. So emotions or states of being, right? La pregunta PHQ9 that might relate to just how you're feeling es esta. ¿Se ha sentido decaído? Have you felt like fallen, decaído, deprimido, depressed, sin esperanzas, hopeless? So decaído, instead of fallen, down might be a better way to interpret that. Down, depressed, or without hope. ¿Ok? Muy bien. Excelente. Continuamos con más vocabulario útil. So, verbos útiles que podemos usar con emociones. Some verbs that we can use with emotions. And tenemos estar, which is the verb to be for feelings, right? And so we might ask the question, ¿está? Asking the yes or no question. ¿Está triste? ¿Está deprimido? ¿Está preocupado? Or ha estado? Have you been? Not just are you, but have you been? ¿Ha estado triste? Have you been sad? Sentirse. It's very similar. It's the verb to feel, so it's a little more focused in. Sentirse. Se siente. Do you feel? Se ha sentido. Have you felt? Fill in the blank with some vocabulario there. And tener. Do you have? Tiene or ha tenido. So with tener, the difference here is that we're going to use a noun versus here we'll use adjectives. So whereas we might say se siente deprimido, do you feel depressed? We might ask here, tiene depresión. We would use the noun. Okay? All right. Bien. So, duración y frecuencia de tiempo. Duration and frequency of time. Some vocabulario to help us describe how long things last and how often they happen. Casi todos los días. Almost every day. Con frecuencia. Frequently. De vez en cuando. Every so-and-so, from time to time, essentially. En los últimos meses, in the recent months. En las últimas semanas, in recent weeks. Más de la mitad de los días, more than half of the days. I think that's a PHQ kind of, PHQ9 time frame, more than half days. Nunca, never. Recientemente, recently. Todo el día, all day long. Ok, bien. All right, so vamos a ver el SIGECAPS acronym nos va a guiar ahora. We're going to take each one of these topics and I'm going to help you with some Spanish questions for each. Entonces, SIGECAPS, ¿qué significa? Well, the first S there is sleep, sueño. And then we've got interest, interés, guilt, culpa, energy, energía, concentration, concentración, appetite, apetito, psychomotor, psicomotor, suicide, suicidio. Okay, so these are the topics that we're going to now break down, dive into specifically, and I'm going to help you with some questions and some conversation around each of these topics. Okay, empezamos con sleep, sueño. Unas preguntas. ¿Ha tenido dificultad para dormir? Have you had difficulty sleeping? Dificultad para is a great expression for you to know. It means difficulty doing, and then you just put a verb on the end. Ha tenido dificultad para dormir. Ha tenido dificultad para dormirse. So the difference between these two is, have you had trouble sleeping? Have you had trouble falling asleep? ¿Duerme bien? Do you sleep well? ¿Cuántas horas duerme por noche? How many hours do you sleep a night? ¿Duerme durante el día? Do you sleep during the day? ¿Es más o menos de lo normal? Is that more or less than usual? ¿Se despierta en la noche? Do you wake up at night? ¿Por qué piensa que no duerme bien? Why do you think you're not sleeping well? And la pregunta relacionada from the PHQ9 screening is, ¿ha tenido dificultad para quedarse o permanecer dormido? Have you had difficulty staying asleep, basically? O ha dormido demasiado, or have you slept too much? Okay, muy bien. Hey, are you learning something new right now? If you are, we would love for you to like, subscribe, share, comment. All of that activity on this lesson today helps the algorithms know that it's something worth sharing, and other folks who are working on their Spanish are then able to see that this lesson exists and they could learn something too. So thanks for liking, subscribing. That helps us get this content in front of people who really need it and want to learn it. Thank you so much. All right, let's get back to it. Interés. So that was sleep. Now we're on to interest. Interés. Unas preguntas about interest. ¿Qué cosas le gustan hacer? What things do you like to do? ¿Ha cambiado su interés? Has your interest changed en actividades que antes disfrutaba? In activities that you used to enjoy? ¿Ha perdido interés en algo? Have you lost interest in anything? ¿Ha tenido menos interés en algo? Have you had less interest in something? And la pregunta que se relaciona a PHQ9, so the PHQ9 question would be, ¿ha tenido poco interés o placer en hacer cosas? Have you had little interest or pleasure in doing things? Okay? ¿Ha tenido poco interés o placer en hacer cosas? Bien, let's move on to guilt, culpa. Unas preguntas for starters. ¿Lamenta o se arrepiente de algo? Do you regret something, basically? ¿Se siente responsable o culpable por eso? Are you feeling responsible? Are you feeling guilty about that thing? And la pregunta PHQ9 sería, ¿se ha sentido mal con usted mismo? Have you been feeling bad about yourself? ¿O que es un fracaso? Or that you're a failure? ¿O que ha quedado mal con usted mismo o con su familia? Or that you've kind of done bad by yourself or done wrong by your family, kind of thing? Es la pregunta. Energía, energy. Unas preguntas. ¿Ha notado cambios en su nivel de energía? Have you noticed changes in your energy levels? ¿Ha subido o bajado su nivel de energía? Have your energy levels gone up or gone down? ¿Tiene suficiente energía para cumplir con sus labores diarias? So do you have enough energy to, follow through with your daily responsibilities? Like deberes, responsabilidades, etc. So deberes would be just like your regular chores and obligations and responsibilities. La pregunta PHQ9 related is, ¿se ha sentido cansado o con poca energía? Have you felt tired or low energy? Concentration. Concentración. Unas preguntas. ¿Puede concentrarse bien en la escuela o en el trabajo? Can you concentrate well at school or in work? ¿Es difícil enfocarse o concentrarse? Is it difficult to focus? ¿Completa sus labores a tiempo? Do you complete your responsibilities on time. And la pregunta PHQ9 sería, ¿ha tenido dificultad para concentrarse? Have you had difficulty concentrating en ciertas actividades, on certain activities, tales como leer el periódico o ver la televisión, certain activities like reading the newspaper or watching TV, etc. El apetito, appetite. ¿Tiene apetito? Do you have an appetite? ¿Disfruta la comida más o menos igual que antes? Are you enjoying food more or less the same as before? ¿Recientemente come más o menos de lo normal? Are you recently eating more or less than usual? ¿Ha bajado o subido de peso recientemente? Have you lost or gained weight recently? And the PHQ9 question that's related to this would be, ¿ha estado sin apetito o ha comido en exceso? So have you been without appetite or have you eaten excessively? Okay, psicomotor. Psicomotor, getting close to the end. I'm kind of going fast. There's a ton of vocabulary up here. Make sure that if you're not on the blog post, you head over to the blog post so you can get the free download, this slide deck with all of the notes so you have them to study, okay? Unas preguntas. This vocabulary you can also study in a Quizlet set on the blog post. So, psicomotor. ¿Tiene dolor sin razón? Do you have any unexplained pain? ¿Se siente inquieto o ansioso? Are you feeling restless or anxious? ¿Ha notado una falta de coordinación recientemente? Have you noticed a lack of coordination recently? ¿Le cuesta las actividades diarias como cepillarse los dientes o vestirse? So, le cuestan, are they difficult? So, are daily activities like brushing your teeth or getting dressed difficult? And la pregunta PHQ9, ¿se ha movido o hablado tan lento que otras personas podrían haberlo notado? Have you been moving or speaking so slowly that other people may have noticed? And another one, o lo contrario, ¿ha estado muy inquieto? Or, on the other hand, have you been really restless o agitado, agitated, que ha estado moviéndose mucho más de lo normal, that you've been moving around a lot more than normal? And finalmente, suicidio, suicide. Unas preguntas. ¿Ha pensado recientemente que tal vez la vida no vale la pena? Have you thought recently that maybe life just isn't worth it? ¿Ha pensado en suicidarse? Have you thought about dying by suicide? ¿Quitarse la vida? Taking your life? ¿Piensa así a menudo? Do you think like that frequently? ¿Ha pensado en hacerse daño o lastimarse? Have you thought about harming yourself? ¿Ha pensado en dañar o lastimar a otra persona? Have you thought about harming someone else? La pregunta PHQ9 relacionado sería, ¿ha tenido pensamientos de que estaría mejor muerto? Have you had any thoughts that maybe you're better off dead? O thoughts about lastimarse de alguna manera, or thoughts about harming yourself in some way? Okay, unas notas situacionales, a few situational notes. You know, there are all these markers in life and events and situations in life that cause stress and cause mental health challenges, right? And some of the big ones that psychologists, mental health professionals say are large stressors on life. Cosas que causan estrés would be like a death in the family maybe, divorce, demasiadas responsabilidades, just being overwhelmed, too many responsibilities, mudarse, moving, enfermedades graves, so, bad illnesses, and pérdida de empleo o problemas en el trabajo, so loss of work or problems at work, problemas con finanzas, financial trouble, and problemas con otros miembros de la familia, problems with other family members. So all of these things are generally large stressors in life, right? Well, when we think about the general large stressors in life, and you think about the typical situations of maybe a relatively recently immigrated patient of yours, is there a lot of overlap or not so much overlap? Here are some things that that I was thinking through as you consider the situations of your immigrants. Las realidades para inmigrantes. So first of all, inestabilidad en el trabajo. That's normal, right? For someone who's a recent immigrant, whether they have a legal ability to work or they're not working legally, job instability is a reality, ¿verdad? Múltiples trabajos, multiple jobs to make ends meet. Inestabilidad de hogar, so it just kind of general instability within the home. Separación de familiares. Many people are in the situation where one member or a couple members of the family have immigrated and others are staying back in home country and providing financial help back in the home country, and so complete separation from family. Traumas durante inmigración. The more you read about immigration and what it takes to get here, there are just so many traumas and really atrocities that happen to people through that process. So trauma, for sure. Ingresos bajos, low income. Dificultades sistémicas en buscar atención médica, so just systemic difficulties in getting medical help. There's a good chance that, that these kinds of mental health questions and conversations and talking about depression could really hit with some of your patients. And so thanks for investing some time in figuring out how to talk through some of these questions and screen your patients for depression. I wanted to let you know about a couple of things. First of all, Mastering Medical Spanish is our medical Spanish course that we offer twice a year. We offer it in the fall and in the spring of every year. It's a 3-level course, so you take a test and decide which level fits you, beginning, intermediate, or advanced. And you can earn some CME credits and walk through a 10-week lesson where you're learning online, joining live sessions, you have a conversation partner. It is a wonderful way to improve your medical Spanish. So if you are not on our medical Spanish list, make sure that you download the notes so that your email's in the system, or that you reach out so that you can join our community and we can let you know about Mastering Medical Spanish. And of course, Medical Spanish Immersion, we also offer these programs twice a year, these trips. We are currently traveling to Costa Rica and Ecuador. We travel in the winter and in the summer. And so we've got fall online course, winter trip, spring online course, summer trip. So all throughout the year, there's something with medical Spanish that you could be doing. So if you'd like to learn more about traveling with us anywhere from 1 to 6 weeks, abroad in Latin America on a very well-intentioned and focused immersion program, we would love to have you. Your family members, your spouse, partner, whether they're healthcare or not, are welcome to join, and it is a lot of fun. Okay, amigos. Bueno, si tienes preguntas, make sure you post them in the comment section below this video. We'll be sure to keep our eyes out and respond to those questions. Aparte de eso, gracias por aprender español conmigo. Juntos mejoramos comunidades. Together we truly are improving communities. Para más español, head over to the website, commongroundinternational.com. And if you'd like to take a medical Spanish terminology test, head over to Certified Spanish, where you can create your free account and take as many medical Spanish terminology tests as you would like. And then when you're ready, you can go through the process of getting certified in medical Spanish. Bueno, amigos, hasta la próxima vez. Ciao.